Epinephrine is a neurotransmitter and hormone that mimics the effects of its naturally occurring counterpart in the body. It plays a crucial role in the body's sympathetic nervous system or fight-or-flight response, making it a sympathomimetic. Epinephrine acts as a mixed alpha-beta agonist, binding to both alpha and beta receptors. However, it has a stronger preference for beta receptors than alpha. To simplify, epinephrine is mainly a beta-1 and 2 agonist, with mild alpha-1 agonist activity, as the activity of the other beta and alpha receptors are less clinically significant. Beta-1 receptors are mainly found in the heart. When epinephrine binds to these receptors, it leads to a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. This causes an increase in cardiac output and therefore blood pressure. Beta-2 receptors are mainly found in the lungs and skeletal muscle arteries. When epinephrine binds to these receptors, it leads to bronchodilation and vasodilation. And alpha-1 receptors are mainly found in veins and arteries. When epinephrine binds to these receptors, it causes vasoconstriction. At lower doses, there is more beta-2 activity, causing vasodilation, which decreases blood pressure, whereas at higher doses, there is more alpha-1 activity, causing vasoconstriction, which increases systemic vascular resistance, and thus blood pressure. Epinephrine is also known as adrenaline and epi. Epinephrine's positive inotropic effect is useful in treating acute heart failure and cardiogenic shock, whereas its positive chronotropic effect is useful in treating bradycardia and cardiac arrest. On the other hand, its vasoconstrictive effect is useful in treating severe hypotension, such as from septic shock, as well as delay absorption of local anesthetic and control superficial bleeding. And finally, epinephrine's bronchodilatory effect is useful in treating anaphylaxis, bronchospasms, reactive airway diseases, such as asthma or chronic obstructive pulmonary disease, also known as COPD. Adverse effects of epinephrine can include chest pain or discomfort, arrhythmias such as tachycardia, hypertension, hyperglycemia, nervousness, and tremors. For many indications of epinephrine, hypovolemia should be corrected before use. Intravenous epinephrine can be used to treat most of the indications mentioned earlier. When used to treat cardiac arrest, it is given as an intravenous push. Otherwise, it is generally administered as a continuous intravenous infusion. It can be ordered in micrograms per minute or micrograms per kilogram per minute, based on facility preference, and with or without a range. If a range is provided, the infusion is titrated to achieve the target indicated by the MRP. This is usually a heart rate, blood pressure, or mean arterial pressure, also known as MAP. While on a continuous epinephrine infusion, an individual is usually in a critical care setting where close monitoring can occur. An arterial line is preferred over non-invasive blood pressure. Additionally, a central line is preferred over a peripheral. If a peripheral IV is being used, it is preferably in a large vein for short-term use and low doses. The peripheral IV should additionally be monitored for extravasation or leakage of the medication into surrounding tissue, as it can cause tissue necrosis. If needed, extravasation is treated with phentolamine, an alpha blocker, which is injected around the site, and adverse effects such as chest pain, tachycardia, and hypertension should be reported to the MRP. Inhaled epinephrine is used for its bronchodilatory effects. However, excessive use can result in paradoxical bronchospasms. When using inhaled epinephrine, a respiratory assessment should be completed as appropriate before and after administration. This can include auscultation, respiratory pattern, color and character of sputum, and pulmonary function tests. Finally, subcutaneous and intramuscular epinephrine are used to treat anaphylaxis. The injection should be given in the anterolateral thigh, or the front or side portion of the thigh, and in an emergency, it can be given through clothing if necessary. After injecting, the site should be massaged well to enhance absorption and decrease local vasoconstriction. I hope you found this video useful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!